My name is Adolfsson, and I am a sales executive at Visiba Care. I'm also one of the founders. I'm sitting here with Peter Adolfsson. Peter, you are passionate about improving the lives of diabetics. And then I googled you have to do that these days, and found this. Now this is from a while back, but it's still interesting. You received an award about 10 years ago for significant innovations around the treatment of childhood diabetes, with a focus on non-commercial innovations that improve the health and quality of life for children and adolescents with diabetes. I think that ties in pretty well with our vision, empowering healthcare, improving lives. So it's really great to get to talk to you about this.
Thanks. Same here.
My first encounter with diabetes was when I was 8 years old. I was at a children's camp, and there was a guy in my room who was 9 years old, and he would do the injections himself. That was a little scary. It must have been in the early 90s. What would you say if you were to sum up the past decades? What has really happened for diabetics?
Wow, a lot has happened. In addition to the blood sugar meters that become smaller and faster, in the 90s you had to wait 30 seconds to get a level, whereas today you only wait 4 to 5 seconds to get a level. But the blood glucose meters are being used less and less. We've moved on to continuous glucose monitoring instead. You stick a sensor under the skin, or insert one under the skin, and voila! You get a new glucose level either every 5 or every 15 minutes, day and night, for several days in a row. That has made things easier. It's become a huge improvement. In parallel, the pens have become even better. We currently have downloadable insulin pens, where we can see what doses the patient has taken and when. We have pumps that have become smaller and smaller, better and better. Some kinds don't even have a tube, so the patient can choose from a variety of techniques to help themselves improve their health. Today, I can see my patients much more often, but in a much better way than via a phone call. I can see them numerous times, very easily. So when we introduce new technology and we need to adjust things a little bit, here or there, then the video consultation works enormously well. And if I then have someone with diabetes who practices sports, that person often needs fairly frequent feedback to have a successful treatment, as opposed to a regular follow-up appointment every 3 months. Then you can keep the communication going continuously, and maybe a follow-up question comes, and presto, you've taken 3 steps forward with the patient instead of just 1. That's what a video consultation does for me. The plan moving forward, if you look ahead from what we're doing today, is to also be able to give the patient quick and frequent feedback, depending on how they're doing. And then, I also want them to be able to do the same with me, contact me with questions, comments, requests. But the problem there, when you're on the patient end, is that you don't know when the doctor or nurse will respond. That's the beauty of an asynchronous chat. When they get in touch with us in the future, I hope to be able to say that, on Thursday afternoon I'll sit down with the nurses and my colleague, and we'll respond to you. You'll receive an answer on Thursday afternoon. That's the best thing with asynchronous chat.
You've conducted a study on online consultations, where you specifically examined how long it takes to see patients digitally, compared to a traditional, in-person consultation. What did you discover?
When we started, I guess I was faster. In the beginning, it often took me 18 to 19 minutes, while my colleagues in Halland and Kungsbacka landed at 23 to 25. Over time, we've all gotten faster and faster. If I'm in very close contact with certain patients, we can sometimes take 10 to 12 minutes for a consultation. And today, I'll gladly take 2 video consultations instead of a visit on location. That means I can easily double the number of appointments, because we're using video instead of the standard consultation.
There's a lot of talk about annual health checks, or maybe semi-annual ones. Has that become a bit passé now?
What we're doing now is we are looking at the results we've obtained from a clear, well-conducted study spanning a year of video consultations. But we have taken a big leap forward, because we really just want to create this standardized track where everyone does the same thing. If a patient feels great, takes good care of herself, and everything is going smoothly, then a patient like that could actually just give me feedback every 14 days that everything is going great. She doesn't need to come in. Maybe she only needs that one annual in-person consultation. Whereas a person who signals indirectly via his glucose check that he actually needs help, support, training, new technical equipment, or the support of another person from the team, he should at least have the option to get much more of all that. So what I actually want to create is what a lot of people talk about, but few do in reality: patient-centered care, where you get the care you need to improve your health.
Man helt enkelt får den vården man behöver för att skapa bättre hälsa.
You're talking about video consultations as a different type of consultation. When you discuss with your colleagues and they say, "We're already doing that over the phone," you respond, "Yes, but video consultations are something else entirely." Explain that a little. What do you mean?
Communication involves more than just hearing a voice. When you look at someone, you can see if they look happy or sad. I can suddenly find myself someplace other than my home or my consultation room. Instead, I'm at home with Amanda or in Robert's kitchen. I can get a little glimpse of what it looks like outside, in the garden, and maybe say, "What a beautiful home you have." And all of a sudden, 3 people are smiling. I'm in their home environment. I can see pets walk by or sit on their laps, and maybe we only talk about that for a very brief moment, but it improves the overall consultation enormously.
Vara där en liten stund, men det förstärker det generella samtalet så väldigt mycket. Så att video är någonting helt annat än
So video is completely different than a phone call. I think anyone who has tried Skype, FaceTime, or simply sees someone understands that it's different than just hearing someone over the phone.
Förstår det att det är annorlunda än att bara lyssna till någon.
You could even call it a digital home visit.
Absolutely. That's a good name for it, I think, because that's actually what you're doing. Sometimes you also end up doing a digital home visit somewhere completely different, where the patient is on a trip or abroad or someplace other than at home or at work. And that's also the great thing about these video consultations. There are no limits to where you can have them. You don't have to go someplace and sit around waiting for the nurse or the doctor. Instead, the consultation can take place in a car, or on a trip to New York or South Africa or anywhere, as long as you have a connection.
When it comes to technology, Visiba Care is a form of technology, a platform for online consultations. And for those of you working in healthcare, the way it works is of course critical. So my question to you is, what do you consider important when it comes to this form of technology or platform?
Komma in på portalen, snabbt se om det är ett drop-in-besök eller om det är ett...
For me, it's really important to be able to enter the portal and quickly be able to see if it's a drop-in consultation or if it's a planned consultation that is scheduled in the calendar, that I can just click on that name, the person I know I'm seeing.
Att som idag, att jag alltid får en automatisk check. Ser du dig själv, syns du, bild?
That, as it happened today, I always get an automatic technical check. Do you see yourself? Is your screen working? Is your audio working? Yes, it's working. How do the headphones work? Or can I hear the other person talking? And then I can click Start the consultation.
Den tekniken patienten väljer hemifrån i mångt och mycket. Men för att få det här spåret att fungera, då skulle jag säga att det som är
In many ways, after that, I'm dependent on the type of technology the patient chooses to use at home. But to get this part to work, it's really important to have a well-functioning collaboration with the team, with one's own data units out in the healthcare organisation, that they listen to what we say and don't just introduce new technology randomly. They need to understand that once you start, you have to follow up. Not all technology works smoothly from the get-go. Creating the perfect consultation is a bit of a learning process.
You work with different formats of follow-up appointments and so on. Do you work at all with any content that the patient brings into the consultation?
Sometimes yes, absolutely. Sometimes I let the patient take over the analysis, like, can't you show me? It's the perfect thing to do with someone when you want the responsibility to shift to that person, or when you see that now is the time for them to lead the conversation.
Man vill att ansvaret just ska flyttas till personen eller när man ser att nu är tiden mogen för dig att leda samtalet.
And I guess it's up to me to do even more of that in the future. Those opportunities exist, and we really take too little advantage of them, I feel. Why am I the only one sharing a screen? They can prepare for the consultation from home as well.
Med att varför är det bara jag som ska dela skärm? De kan förbereda mötet hemifrån.
Looking ahead, I also envision that we'll use other instruments, such as short surveys or asking them to show me where they are on a scale, describing how they're feeling about their condition. And then we will discuss how they're doing emotionally. So there's a lot to be done.
Så här finns det en del att göra.
När man träffar dig nu då?
When someone sees you in this digital environment now, compared to before, as in the case of Visiba Care, where you download an app or you see healthcare on your computer, what do patients and relatives say about this new format of doing the appointments?
Behöver precis som vissa kollegor bara ta sig över gränsen, bjudas in, våga upptäcka att jag har ju samma check som Peter.
Overall, the feedback is positive. Some colleagues, they just need to cross over, be invited in, dare to discover, wow, I have the same technical check as Peter. By that I mean that they need to be championed and given some instructions on how to get there. A common thing, and funny thing, is that before they turn off the video, on a number of occasions, I've heard them commenting on how it went, like, this was really easy, or that was great. With other words, actually, stronger words.
Varför ska vi åka in så ofta? Det här ska vi ju köra istället. Så att för det mesta väldigt positivt.
Patients think, why should we go in so often? We'll do this instead. So for the most part, it's been very positive. What happens sometimes is that technology at home, the network or the like, can falter. But that's also something you have to learn, I think, and prepare yourself from home. Check that you have a connection that works, because otherwise the internet won't work for anything.
We're working with two visions, empowering healthcare, improving lives. You've already told me that people have gotten their lives back. How so?
Ja, det här gällde kontinuerliga sockermätare tidigare när jag analyserade utfallet.
This was about continuous glucose monitoring systems, when I had previously analysed the outcome in 2013-14 and saw the improvement we achieved in region Halland when we started with this technology. and it also motivated us to use the technology more.
Så att glukosvärden förbättrades utan även livet rent generellt. Och därför frågar vi patienter, vad tycker ni om oss? Men också vad tycker ni?
Not only did patients' glucose levels improve, but their lives in general did as well. So we asked the patients, what do you think of us? But also, what do you think of this technology? Then there were 3 families who wrote that we've gotten our lives back, and that was powerful, to put it mildly. You ask yourself, what is that worth? Is it worth £10,000? £100,000? Is it worth £1 million? For me personally, it's worth £1 million. I guess that's where I land as a doctor, for my patients. I want to improve their health, and often I see technology as an aid in getting there. Also, the investment cost is quite low compared to the added value.
Jag ser ofta tekniken som ett hjälpmedel till att ta sig dit, men också ofta att de investeringskostnaderna då är ganska låga i förhållande till det värdet man kan vinna då.
When you're like me and you work in an organisation like ours, you often talk to procurers or strategists, but then our services often end up being used by people like you. And then we meet you, and you have a macroeconomic approach. You're focused on how you can add value to the life of a patient, quality of life and such. We also talk business models and licensing models, and then you come in and you have a completely different, pretty big perspective, which I find very interesting. If you deep dive into it and observe, now you've worked with online consultations and seen great improvements, and you've worked with other forms of development projects. But what would you say on that now? Because there's the cost for the technical solution, for staff, and a cost if the actualization of the care plan proves unsuccessful. Can you give us a rough estimate of the difference in cost between a patient who can manage her diabetes effectively and a patient who can't handle it as effectively?
Man skulle se att diabetesvården idag kostar ungefär 10 miljarder per år i Sverige. Så är 70%.
If one were to look at the fact that diabetes care currently costs about £1 billion a year in Sweden, 70% of that goes to complications or to cases where people simply develop other diseases linked to diabetes, like heart attacks or strokes.
20% är vi som är personal. 10% läkemedel och teknik. Kanske lite grann ökat.
20% goes to staff. 10% goes to pharmaceuticals and technology. Perhaps a little more, but that's mostly the case.
Se vissa saker som en investering snarare än en kostnad. Och att
It all boils down to seeing certain things as an investment rather than a cost, and analysing the outcome of that investment. Because if we do it now, we save on the big, enormous cost, such as complications and other diseases associated with diabetes. This approach is critical.
Det är det synsättet som är det viktiga. Och just den regionen där jag arbetar, i region Halland, där har man en...
In the region I work at, region Halland, there is a database that monitors all costs related to each patient. So these analyses are on the way. We will be able to look at them, and they will surely help our managers become even better at making the right decisions in the future, not depending on a gut feeling, but on what is, in fact, the right decision.
Bli ännu duktigare till att egentligen ta korrekta beslut i framtiden. Inte beroende på vad som känns rätt i magen, utan vad som helt enkelt är det rätta beslutet.
Man kan tycka att videobesök...
You might think that video consultations are really a pretty simple thing to get going with. I usually use the example of Charlie's Angels in the 60s. They had video communications even back then. What keeps your colleagues from really getting started, even though you show them that there are advantages to this way of working?
It's that infamous threshold. Perhaps I personally tend to be innovative and an early adopter. I test and see. I'm not afraid, I just try. I step over that threshold, and for some people that means stepping over into the unknown, something new, and they feel safe where they are. Then you either need a person standing on the other side, as in our case, and tugging you a little bit, that's me, and explaining and nagging the others, Have you tried it yet? Have you tested it yet? Come and join us for a consultation and see how easy it is.
Antingen som hos oss, en person som står på andra sidan och drar lite grann, och det är jag.
I can't count how many medical students, who have only been with me for 4 days, have chosen to come along and observe the video consultations compared to my permanent colleagues. It's striking that young people understand this right away.
Hur många läkarstudenter som har varit nere i 4 dagar som har just valt att följa med mig och titta på videobesöken jämfört med mina fasta kollegor. Det är slående att unga förstår detta direkt då.
Moving forward, I think we need a stronger push from the other side of the threshold, namely the manager, to tell you that this percentage of appointments must be video consultations, so that you get a push. So it's really that combination right now, tugging, pushing, but also equipping people with training and showing them how easy it is.
Dragande, knuffande, men också då försett med utbildning och en visning av hur enkelt det är.
I have 2 nurses who now conduct video consultations all the time, which has also completely changed the structure of education around diabetes. Now it's via video and webinars instead of face-to-face consultations. They say themselves, "Oh my god, that was so great and easy."
Och de säger ju själva att herregud, vad bra och vad enkelt det var.
You've been researching this, and you have already communicated some results indicating that video consultations improve the quality of life for diabetics, and you can show that in black and white. And yet, it seems that not everyone is considering video consultations. So what are people waiting for?
Ja, i just mitt fall så tror jag att de väntar på några publikationer. Men jag vet ju det att det kommer inte att räcka för vissa.
In my case, I think they're waiting for peer publications, but I know that for some people, even that won't be enough. They'll see these publications and think, how cool, how nice, how great. But moving from that point to starting to do them yourself, that's one more step.
Så att vissa kanske väntar på en formell utbildning om att så här går det till, så här är enkelt.
So some people may be waiting for formal education. This is how it's done, this is how easy it is. They want to be shown how.
Vissa behöver någon som går före på en klinik som helt enkelt visar att det är möjligt inom olika områden.
Some people need someone to lead the way at their clinic, who shows them that it's possible to use in different areas.
Generellt bestämma sig om inriktningen. Och jag tror att nu märker man redan att konferenser.
We've already seen that conferences are being conducted digitally this autumn. I don't know how many virtual meetings and conferences there will be, but the numbers are rising. Of course, you have to implement more and more of this, not only in healthcare and because of the coronavirus, but because it's right, it's appropriate and it saves time and money.
Inte bara sjukvården för att det finns ett coronavirus, utan också för att det är rätt och riktigt och är besparande.
If someone wants to get started with this way of working, with online consultations or digital home visits, video appointments, what messages would you like to pass on?
Ja, det ena är väl att gå in på
One message is to go to Visiba Care's website and see the videos. See for yourself how easy it is.
Se hur enkelt det är. Det andra är att lära sig med sådana som har gjort det.
The second is to align with people who have done it and ask them about their experience. How do you do it? And not just the person sitting on the other side of the screen. Talk to the administrative assistant too, about smart solutions, appointment notifications. How do you do it? And learn from each other about this, so you don't have to reinvent the wheel.
Skapa hjulet själv på något sätt. Man behöver inte uppfinna hjulet, utan lära sig av varandra.
And start small, with a few patients that you know well. The ones that are strong and will do the right thing. See how easy it is and build from there. Don't start on a large scale, just start a little bit, because you'll still get a wow moment. That was easy. Now let's do this.
Inte börja storskaligt, utan börja lite grann, därför att känslan kommer att bli wow ändå. Det här är enkelt, nu kör vi.
Well, all that is left to say is good luck with digitalization. Thanks, Peter.